guys, thanks for joining me this week's podcast. My guest today is Aldo Carinci. Is that pronounced right, Chris?
That's
Aldo?
correct. Yes, that's
Okay.
very good.
I know Aldo for years, and Aldo, with this time, what's going on with the COVID, where you work, health and safety, that becomes very, very critical for businesses. We never thought that the time will come that where the health and safety will become so critical that it's even part of survival in a business. So I'm looking forward to learning from you, and thank you so much for joining me in this podcast, Aldo.
Thank you so much for having me, Gurmeet. I'm actually very happy that you invited me to be part of this, and this is something that is really useful because a lot of people don't realize some of the things that have happened over the last little while, but some of the changes that have happened within the time frame. So I'm happy to be here, but it's been a busy time. A lot of people are still trying to keep up with doing what they need to be doing with business. And, we're here to help them out. iSource Solutions has been, around since 2013. We have evolved since then, of course. So just kind of going back, my background is in risk management, loss prevention, safety. I worked for a lot of different corporate 500 companies like Gap and PetSmart and Winners, TJX. So I learned a lot over the years, over almost 30 years of doing this. So we've been working hard towards that. And the last few years of my corporate world, let's call it, I decided, it was probably 2 years into the making that I was going to start my own business and get into something that I enjoyed and try to help people out. And I realized there was a big gap towards health and safety in some of the small and mid-sized businesses. So we decided to go forward and say, take an opportunity where at that particular moment, the legislation was changing as well. So the timing was good. So we basically started iSource Solutions, and it wasn't a startup from the beginning or a startup in general. It was a lot of partnerships that I've had over the years and calling people from different areas of businesses and letting them know what I was going to be doing. And it was a chance that I took because I had a small family at the time, 3 young kids. My wife wasn't working, so I decided to take the leap of faith, they call it, right, and work towards building a business. So I called a couple of people that I knew, started working with them, clients that helped me out up to this day. I still have those clients 7 years later, going into my 8th year. And work towards building the business and created something that people appreciate, because a lot of times when we go into businesses, we're looking for the opportunities for them to be better in the business because we know what we have to do specifically in those areas.
So give us.
Then went into distribution, the operations side, worked towards that, became a regional director in Winners. And then I got recruited into Gap, and I got recruited there from a recruiting company calling me that they needed to develop this whole program in Canada because Gap didn't have anybody in Canada, Gap Canada at the time. So they brought me on board. I built a whole team there. We had about 25 different individuals between health and safety, loss prevention, security, took over the distributions. So I did a variety of different things. I was a director of loss prevention and safety across Canada for Gap. And then another opportunity came up with PetSmart. Same thing happened years later, where I went into the same sort of field, but created their department for health and safety in Canada, and also did loss prevention and distribution. So I kind of did a variety of different roles, always at the district regional director level. So it's been a journey, and enjoyed it. I loved it. A lot of travel. We did a lot of traveling across Canada, US, helping a lot of different stores and locations, opening up new stores, construction. So I have a variety of different areas of expertise that I've utilized over the years.
So I understand you guys do certification and a training in health and
Yes.
safety. What else is involved in for business leaders to take a look at what's involved in health and safety from your side?
Well, the health and safety program, starts from a lot of companies will have something written. A lot of people have a policy written, health and safety policy, basically a statement stating this is what we believe in. But there's no, I guess there's no teeth to it in a lot of cases. I say there's a lot of things that people don't realize you have to have in a health and safety program. A lot of things that you have to do prior to developing health and safety procedures, because you don't want to be having this, Google search. A lot of people do this. Google search all the policies and they just put their logo on it.
Yeah.
Right. And that's not what you want to do, because that becomes part of your sort of day-to-day operations. And if anything happens legally, or unfortunately there is an accident, that becomes part of your infrastructure. And they're going to say, oh, okay, you said that everybody's being trained. Meantime, the president of the company might not be being trained because they're just, obviously overseeing the business. So you need to have that indicated inside the policy. So we create the policy procedures for companies. You need to have that information there. They need to conduct their hazard assessments, which nobody really kind of does in a lot of cases, especially small businesses. They say, well, what do I have to do that for? But it's very important to know what your hazards are. Even in an office environment, there's hazards. There's people that get hurt in an office environment by, not following procedures, or not using that chair to clean the shelf, or using an unsafe sort of platform to reach up to get something. And those are all things that we come in to demonstrate and show that. So.
Got you. So from your thoughts, what has changed with the COVID? I know before COVID you were doing it, and now it's COVID. So give us a little bit of insight. What has changed? Health and safety seems to be one of the critical items that you need to keep your people safe.
I always say to people that are saying, things are so different now, and health and safety in the Occupational Health and Safety Act has always been there. It's been over 30 years. So if you look at the Occupational Health and Safety Act, everything that they're talking about today with COVID, having a site safety plan, making sure that you're doing everything reasonable to ensure that you reduce that hazard, it's all there. It's all been written for 30 years. It's just now it's highlighted, of course, because we have a pandemic. So what's changed a lot was I think people's interest around safety, people wanting to do the right thing, people wanting to have things done specifically for their company. It's not generic anymore. It's not like the generic policy and procedures anymore. It's more about, how do we create that site-specific information to ensure that, we're protecting our company? Because at the end of the day, you want to be protected, as much as possible. So a lot has changed when it comes to the mentality of people, business operators that are looking at it from a different perspective. A lot of family-run businesses are turning to us to say, we need something, because even though we've had certain pieces in place, but we don't know what we have to do because we've never done it for 30 years. So that's what's changed. A lot of people are taking the responsibility and saying, what, especially with reopenings, a lot of companies that have to be reopening, you have to have the protocols and you have to display the protocols. Those are things that have changed, and I think it's here to stay. It's not going to change back to how it used to be. It's going to be just evolving more and more. Yeah.
Well, from business leader standpoint, we need to reopen companies. We need to run a business. When you also need to keep our people healthy. So we have to strike a balance between those two. So how do you finding that business leaders, how they struck a balance? How do they find that, we need to, the first item is we need to keep people safe right now, so they can safely work. But how do they find a balance moving the business forward? What is that, what's the opportunity operationally?
Yeah, that's a really good point, because in a lot of cases you have companies that were already doing things that they probably don't even know that they were doing. That was part of the safety aspect of their business. So we try to highlight that, when they've called us and said, how do we balance this out? How do we do it? So you're already doing it. It's just a matter of highlighting it and documenting it. And we show them how to do it, automate it, make it a little bit more simplified for them. So things have changed in that way, but there's also the benefit around people already were doing it probably, but it's just highlighting that they're actually doing it and making sure that they have it documented somewhere. Because the biggest thing right now is Ministry of Labor, for example, they'll go into a business, doesn't matter what businesses. If you look at the Ministry of Labor webpage right now, they'll talk to you about blitzes and inspections. They'll go to any business and basically come in and say, hi, let's take a look at the first thing they'll say, COVID-19 protocol. And what does that look like? And they're looking for the basics, signage, the visible, sanitization, process that you guys are doing. They're looking at your facilities to make sure that the bathrooms are equipped. And some companies could cope with that, and some can't. Because a lot of times you get companies that are construction related. They're on site. Now it becomes more difficult to be a little more protocol when it comes to the COVID side. So basically, it takes a bit of balancing. It takes a bit of commitment from the leadership to make sure that it's being done. And then at the end of the day, it will benefit them in the long run. But a lot of these companies are doing certain things. They don't even realize that they're doing it. So we come in and try to figure out, okay, you were already doing this as part of your policy procedures that you've been doing. So how do we document it to make sure that it's a safety piece to it, right?
Got you. What are your thoughts on work environment changing because of health and safety? The 2 meters distance, we used to have a small cubicle where people sit in, or open spaces. Do you think people are, reconfiguring their workspaces, how they sit close to each other? How does that change? Because that changes entirely office space. How much office space do you need? How are you going to put people in workplaces? That completely changes their configuration.
Oh, absolutely. There's companies that I've spoken to in the last probably 3 weeks where they're shutting down part of their offices, and people are working from home indefinitely. They're not going to be coming back because they've been set up now at home. It's been working for them, and those are all kind of like the situations. But companies that can't do that, there's a lot of ways to kind of do the barricades, and people are asking for plexiglass, because we got into the PPE business too now, because a lot of our clients are asking for protective equipment and all these things that you require to be compliant. And part of the office environment is, how do you distance people when they're in cubicles? So people have to understand that you have to distance, but maybe there's barricades that you could use, and there's a lot of products out there that we've been utilizing and passing along the information to the companies to be able to share that, because plexiglass barriers, there's different seating arrangements that people are doing. Offices are being sort of like designated where people are alternating different times of the day that they're coming in. Some people are working 1 week. Another company that I'm dealing with, they have their employees coming in 1 week, and the following week it's another group. So they're kind of keeping that bubble close together and trying to keep the same people together, so it's a little easier in case there is some sort of exposure. So there's always ways of getting around it, but some of the bigger companies that have thousands of people in these offices, that's going to be the biggest challenge of people coming back right now. And I think that's being looked at. If you go look downtown Toronto, quite a few for lease buildings for space, a lot of that happening right now, because companies are looking at it saying, well, you know what, I could probably be having my 350 people working from home, and it's working for us, and we're still getting the job done. So why not do it that way? So it's going to be a challenge.
So it's a lot of things changing, not only health and safety, how people work, the work environment. How does training play a role in this? All these things, because you're making so much, dramatic changes in the businesses and people's lives. How does how do people keep up with all these things, changes in a business?
That's a great point, and also it's a challenge. Training is critical. Safety, like any other training, the safety training is critical. People need to know what they need to know, because if they don't know, something happens. Exactly. The owner operator, the company director, the first question that'll be asked is what did you do reasonable to ensure the safety of that individual? And even if it's such common sense saying, you know what, you shouldn't be putting your finger in that socket, but that person decided to put their finger in that socket and it's not documented somewhere, you can definitely be the person that could be liable at the end of the day. So training is critical. And I say for any business leader, you need to ensure that your employees are trained, especially for COVID now. There's all this, new training material that's being offered through different types of areas. Ontario government is offering free training with regards to COVID. Those are all generic information that they're giving you to say, create your content, use our stuff, but create your content to make sure it's reflective of your business. If you don't want to have something that's just generic saying, it's covering your business like every other business, because a company that maybe is running a manufacturing company versus a construction company, there's different hazards. So you want to make sure that you capture that training in that sort of.
I got you. So government provide generic training, then you have to enhance that training with your custom training to whatever apply to your business, and you have to make sure that. I got you.
That's correct. It's like women's training. Women's training, everybody knows women's training, chemical training. Everybody should, everybody does the generic women's training, but there's two parts to it where you have to do your site specific. So if you're using any type of cleaning agents, or you're in an office environment, and believe it or not, you have things like fire extinguishers. So the powder in the fire extinguishers, people need to know that if you discharge that could be dangerous to you, right? So a lot of people don't realize those things, but those are all site specific. So that's where you get a hazard assessment completed, where you do that either internally or get a third party like us coming in to do it, where we identify all those things and we come up with a plan for you and make sure that it's created properly.
Got you. So a lot of business owners, they're probably in the same boat that, I'm in, or in a lot of other, they're all thinking, how do I get back in a business? How do we generate, revenue growth again? We get back to that growth that we've been waiting for so long. As they're planning their business strategy for this year, how does the health and safety comes in? What do they have to take care of, and what do they have to consider when they're planning their growth this year?
Yeah, the important piece is to ensure that if you don't have a health and safety program, obviously you have to conduct an assessment to your business, understanding, what are the major hazards that could contribute. So for example, you have a company like yourself, you have situations where you have people traveling to and from work with their vehicle, having that sort of in that hazard assessment, saying that's a risk, that's a workplace related situation where if somebody gets into an accident, how are we going to deal with that? How are we going to relate to that? So those are all things that have to be considered, those type of areas of business. And then the other thing is to making sure that people realize that training is not just a one-time thing. The program should be, we try to do a lot of micro learning. So it's not like just saying you take 5 hours of in 1 year for the first year, and you do all the training in 5, 6, 7 hours. It's micro learning right through the year. So at the end of the day, you have a variety of different things, and it's continuous learning. And you have to ensure that as a business leader to keep that information up and running all the time by what you're doing. Like you're having meetings, talk about safety for 5 minutes. You have a meeting with your staff, you do a virtual meeting, talk about safety for 5 minutes. That's all it takes at the end of the day. Have it documented, but those are all things that have to be part of the program to develop a program that's going to be robust. And then there's also rebate programs or incentive programs. A lot of people don't know. WSIB offers excellence program. There's different certification programs. You have a good foundation operationally, but also a safety program that you're able to prove that you've had within your business for the last year, and you're able to prove all that. Then you could go forward and try to get those rebates and bring in more, not only revenue, but also the costs that are associated with doing all this. You could pay back your costs. And reinvest that money back into your health and safety program. So it kind of continuously every year you're receiving the rebates, and then every year you're actually using that money. So
there's a financial incentive that to justify your investment that you make.
Program. Yeah, it's called Excellence Program. There's a certification called Core Certification. There's a lot of different programs that are out there that a lot of companies don't realize. And if you're a small business owner, you're eligible for it as long as you are in that WSIB sort of platform, and you're paying your premiums, and you have no injuries or accidents that are serious. You're eligible for that, and that's what we help companies do as well, to say, okay, you know what, you have a program, we enhance your program, or we create from scratch, and then we go forward to try to get some sort of financial incentives too in the future for companies, and we've done that for quite a few of them.
So a lot of companies, as you mentioned, they were doing health and safety before COVID. And then a COVID hit, and a lot of rules and regulation changes. So how do they get that information? That we were doing this before, we were doing okay, but these few things changes. So how do they get that information? How do they integrate into their previous health and safety and go about it? After COVID.
Yeah. So one of the best, one of the two best resources that are out there, and it's free resources. We're there to kind of guide people through this stuff, to make sure that people know that, there's certain pieces that, there's a starting point. So the Ontario.ca government webpage has a whole load of COVID-19 pieces. They also have an assessment in there for you to do, so you can kind of guide yourself. And those are all kind of like the generic basics that they want you to start doing. And then if you have obviously complexities in the business and you need more expertise, you could call on a third party or someone, or maybe internally there's someone that's health and safety related where they could assist. Sometimes it's an HR person, but there's that. And then also if you're in the Toronto area, the Toronto webpage for Toronto, City of Toronto, they have a lot of great resources in there around COVID. They also give you a site safety plan that you could create and go through, kind of give you an idea of sort of things that you have to do. And a lot of people have called us, even though we've passed that information over to them, they call us and they say, okay, you know what, our company needs this, but they don't really indicate that in the plan for you. They don't write the plan for you. They just basically give you a template, say, here you go, answer these questions. And we help people through that and try to consult them through that whole area. So
I see. Do you see this COVID-19, the rules and regulation came down? You think they're becoming a legal requirement, or is it just you need that in a business? You see that coming down as a compliance?
I think so. Part of it, and again, part of the compliance piece with the Occupational Health and Safety Act, call it the Green Book. We call it the Green Book.
Okay.
Basically, it's already in there. It doesn't talk about COVID specifically, but it talks about pandemic planning. It talks about emergency procedure situations. It talks about all that. So it's already part of the DNA of the Occupational Health and Safety Act. It's already part of the legal obligation that we have. Also, the reasonability. We have to ensure that we protect people, reasonably. You can't do everything possible, but you have to be, doing reasonability. So if you're doing something reasonable and you're able to demonstrate that, then the ministry, or if something unfortunately happens when they inspect or they investigate, it's not negligence causing that injury or causing that unfortunate death. A lot of times with COVID, for example, with the death that's happening right now, unfortunate deaths that are happening right now, public health will get involved. Public health will get involved if it's work related. Ministry of Labor will be part of that whole thing, and the Ministry of Labor will look at all the areas of the business that you have when it comes to COVID to ensure that you're not negligent for causing this person to get infected in your business, because it could happen, and it's happening. Obviously you can see there's like a lot of companies that are reporting now, which you have to report after you had two or more. You have to start reporting immediately. So those are all things that you have to be cautious about, because I think it's here to stay. And I think this is just sort of like a starting point where now people are going to say, this is serious. We have to make sure not only COVID, but things that are coming, down the line. But this has always been in the act. That's what people have to understand. It's always been there, but it's just something that now all of a sudden, because of the COVID, it's been pulled out and said, we better start following this from, every single rule that's there, because at the end of the day, you want to be protecting your company and your employees, especially. So
I got you. But there's every time you add more rules and regulation, or you add, there's a cost of product and services has to go down. It's going to go up. Impact of it. How do you think the business, especially in travel and tourism or restaurant businesses, right? They have to take a lot of things on health and safety side, which will impact their prices of services or food will go up. How they compensating this side of things, financially, how they taking over these?
Yeah, that's definitely a big challenge, and I've seen it in businesses that I've had some businesses that are in the entertainment business. They've closed since March. They were going to be reopening. All of a sudden, the next lockdown comes down, and they can't open. So those are serious situations. And
theater's another one. Cinema's another one. Theater's another one.
Yeah, the theaters and stuff like that. But no matter how much compensation, it's definitely going to affect businesses, because it doesn't matter. Even with company like governments giving out, there was a $1,000 fund that they were giving for businesses.
Not gonna cut it.
Not gonna cut it. Yeah, on PPE that they were supposed to do it. You have to have below 9 employees. And it's kind of like the other companies that have to do it. They have to, unfortunately, figure out a way of, generating that revenue. And I think part of the health and safety program, if people had a program from the beginning where they already have a program and it's just enhancing the program and being able to demonstrate that program, a lot of companies, I think, leave money on the table when it comes to, I look back at those, rebates and incentive programs that are out there, the financial incentive programs. So those are all things that I think people have to take advantage of now, specifically to make ends meet, but also help them generate, that safety aspect and buy that PPE continuously. So now it becomes like part of the part of that process, and they have something every year that comes in because they could demonstrate that they are able to show that they have an excellent program, and they're able to show that they could get certified. So those are all the big pieces, and I think it's going to be a challenge for some companies. But some companies are there; they're just they don't produce that information, or they don't know about that information that's readily available for them to go in and get that financial incentive.
Got you. I was talking to a couple of, my client, and, health and safety, they never consider part of their business strategy for year or business planning. But with the COVID, people working from home or they're working remotely, they're considering health and safety as a part of their business strategy, business planning for this year or going forward. You ever seen, do you work with the business leaders where, they need help with building a business strategy and they need health and safety part of it? How they're going to run a business, something happen like this, hopefully never happen again. But if they have to send half a staff at home, or they have to work, shut down their offices, how they go around these things?
Yeah, business continuity. That's part of the process. Like business continuity planning, every company should have that. And when we come into a company, we'll look at a lot of the different exposures, not only from a safety standpoint. We look at from a security standpoint too, not only from not the IT side, but more about the building. You're going in and you're saying, well, where's the exposures here? But business continuity is critical. Like if you get a fire, even like as basic as a fire happens in a warehouse, how are you going to be able to open up? Do you have a secondary spot that you could open up the next day immediately? So your business, those are things that people have to think about, and we try to push that towards them when we're in there. Yeah, absolutely, business continuity. Trying to make them understand that it's not only about the health and safety aspect of it, it's like the whole business. So it's how I approach my business. I want people to approach their business and look at it that way. I
got you. And you think business were prepared when the whole COVID happened? What was the situation? Is business preparing now? How are we finding a Canadian market situation in Ontario?
You know what? A lot of people were scrambling. A lot of people. We had calls coming in from a variety of different companies that we weren't dealing with. We've had conversations with them. They weren't with us. I utilized some of our statistical information. I looked at some of the companies that we had, and I don't want to just kind of share some details around some companies, but some companies that we dealt with on a regular basis. They had their planning in place and things like that, and they just basically opened the page this, and they completed it. They partnered with us. We have a monthly service with them. We're in there. We're trying to get things generated. We were there, completed things immediately. And there was other companies that were kind of like, pay as you go. Let's say you call them. They're coming in, they're calling you for one thing, and you're kind of leaving it out. And that's fine because we have a lot of those type of clients. But those are the clients that were calling us, and we had about at least more than a dozen companies calling us saying, what do we do? Like, we have to shut down because we can't do anything. And there's ways of doing it, but they didn't have the proper conditions. They didn't have the backup, the protocol around, people working from other areas remotely, those type of things. They were just kind of scrambling, not figuring out, what they have to do. So yeah, there was a lot of scrambling, a lot of people panicking. A lot of people, and even still to this day, I still get calls coming in saying, we need this to open up our gyms. We have property management companies that we deal with. Mm-hmm. So it's like, why are you thinking of it now? We've been in this whole situation for the last 10 months. Yeah. And you think about it now, that should have had already a plan in place from prior months before, right? And that's also the board of directors and all these different companies that don't take it that serious sometimes, and that's the unfortunate thing. But they are realizing it now.
So yeah, it used to be just nice to have. Now it just become critical. This is what you need to open your businesses, I guess, right? Yes. The companies who have offices, across provinces or across nationally, different provinces, is there different rules in different provinces they can handle? How do they handle these things? This may apply to Ontario, may not apply to BC or other part of the country.
Yeah, there is different legislations in provinces depending on the situation. Unless you're a federally run company, then you go through the federal side, which is all pretty much the same. But the Occupational Health and Safety Act, there's different acts across the provinces. So BC will have their own, Alberta will have their own, and pretty much it's all pretty close to each other. I always look at it from an Ontario standpoint. If you're running it through like an Ontario how stringent they are when it comes to occupational health and safety, and you're completing, those pieces in the Ontario businesses, then chances are in Alberta, BC, in all these other areas, you'll be okay. But it's just a matter of there's different aspects of, for example, in BC, they talk a lot about earthquakes in emergency procedures because they receive that. They also have a lot of issues around bear attacks, to be, because in workplaces, people walking out and all of a sudden there's a bear in a parking lot, and how to deal with that. Those are all things that they have to deal with. That's part of their legislation. Those are some of the pieces. But the majority of the information is pretty much the same. But you have to definitely know that there's certain key areas that you have to manage.
Got you. There's a lot to learn with this, the health and safety side of things, right? So
there is. It's just like a lot, but sometimes people just make it really complicated because they see that there's so many moving pieces, and there's a lot of moving pieces. But you can make it easy, by ensuring that you have at least a plan in place and understand, okay, you know what, even if I don't have, and I'm not perfect, even if I don't have all the pieces in place, but I have a plan and I know I need to get to that plan. But the critical pieces, when you're doing your hazard assessment and you find those are the critical pieces that you've identified, and you have some sort of gap analysis and understanding that there's a gap and those are legal obligations, then you need to get those to it immediately, because that's what's going to hurt you the most. Because people say, well, what's the cost associated with doing all this, right? There's costs associated with it, but there's a worse cost if you get a death on a job, or if you have a critical injury. That's going to cost you for the rest of your time being in business. And some companies get out of business all of a sudden and lose their business and bankrupt because they're not a safe company, and that's a scary thing. So,
okay. So if I'm a business, the owner, Aldo, and it looks like end of January we'll have better news from government, so we can start opening a business, start going back to offices. What are your thoughts, and how soon you think business will start going back to offices and start operating? Any thoughts on that?
Yeah, well, it's hard to say, but what I hear and what I continue to hear with a lot of different companies. I was just talking to one of my actually close friends that works for one of the major company that has thousands of people that go to the office downtown Toronto, and he said indefinitely they're not going to be going back probably until if they're lucky at the end of the summer. That's what they're saying. If not, they're looking at other means, because they have over 1,000 people that are working from home. Which they've found, they found the balance, like you said before, and they're able to work from home. So I think it's going to be a while before you have companies, and there's some companies that'll just bring people back, and then they'll realize, all you need is one infection. We have to, with this whole vaccination that's happening now, it all depends on the timing of the vaccinations and how many people are getting the vaccination. You start getting this whole herd immunity. It's, you have 80% of the population that's vaccinated, has the vaccine. Maybe then you start going back to opening up some of these offices or some of these businesses, because there's like entertainment businesses that, for example, you have companies like downtown Toronto, Medieval Times on the exhibition grounds. They haven't been open since March. Those are companies that can open, because how do you open? How do you bring people in? How do you manage that whole process? Those are the type of things that you have to look at. Theaters too. In the States, they've opened some of the theaters, but it's like capacity is very small. So they have to look at all that and still continue that until we get to a point where we're saying, like, you know what, we have immunity here. So it's like people are not getting sick anymore as much as we see right now. So.
But what can business leaders, if you give us a couple of pointers, what can business leaders do to prepare themselves when they do open finally, so they're better prepared for when offices open, so they can take care of the people that are better. So there is a few things they can do right now so they can be prepared when a business do open.
Yeah, one of the first things that they should do is create your site safety plan. Understand, the concept, like the situation around what they need to do from a safety standpoint for their staff. That's the number one priority. Have a site-specific safety plan. Make sure that they have something that's documented in writing, making sure that they understand their legal obligation, making sure that they're going to be identifying anything that could be contributing to somebody coming to work and then getting sick. And I say getting sick, not only from COVID, but somebody has a fever and it's just a flu. How do you deal with that now? it becomes different, right? So now people, all of a sudden, you have the sniffles, you have a cough, and it's not COVID related, but how do you deal with that? You know, have good policies in place when it comes to if somebody's sick. Have a good sick benefit policy around. You know, make sure that you don't have HR, you partner with somebody that is in that sort of field, understanding that, you know, you need to have those pieces in place, because if somebody comes in, are you going to know how to deal with if there's an exposure? You know, who to call, how to deal with it. So that's all part of the site safety planning, business continuity planning. Now, that's important. I think that's the biggest thing that a lot of companies lack, that they just go back to work. They think they have some sanitizer on the table. You know, they have masks on, everything's good. But now they don't realize that all of a sudden you have more than you would normally have in the office. And then somebody catches a cold or sick and there's a fever. Now you have to be worried, is it COVID? You know, and how do you deal with that? So understanding, having a plan.
Yeah, and then executing the plan as well, right? You know, business owner, you know, we're not used to doing all this stuff in our businesses, right? You know, I talked to one friend who they check temperature before somebody come in the office and before when they leave, right? So check, you know, all these things we're not used to doing as business leaders. You know, it looks like we have to implement these scenarios.
And that's a great point, because a lot of people don't understand, you know, that the execution of the plan is where you're going to get the benefit from, right? So creating a plan, you know, and having all the stuff documented and just leaving it on the shelf and not worrying about it is not going to do anything. You have to have that plan, you know, alive and kicking, and it's continuous improvement on the plan, right? So you can't just leave the plan and then all of a sudden think it's going to help you in the future, because after something happens, it's after the fact, and you have it in your plan that you should have done it this way. It's not going to help you, right? You need to be as preventative as possible, prevent it, so you could basically at least prove that you've done everything reasonable. And at the end of the day, your staff stays safe, and from a legal obligation, you're complying. But it's just everybody goes home safe, and that's what you want. So
good stuff. Wow, there's so much to learn in this, Aldo. Where can people find you if they want to learn more about health and safety, or they want to be in touch with you? How can they find you?
Sure, absolutely. You know, we have our webpage, www.isourcesolutions.ca. Everything's there right now. We actually revamped it just recently, so there's some great feedback. So everything's there. We have you could call us at 416-399-4553. You could just check us out there. We could, you know, email us info@isourcesolutions.ca. So it's all in our webpage. Everything is there. You know, we have everything kind of laid out. You could schedule through the webpage as well if you want to schedule a time. We do a complimentary assessment over the phone if it's required. So we ask people, just give us a call. You know, we're not going to, you know, charge you because we want to talk to you. You know, just give us a call. We'll talk to you about, you know, what your requirements are. If you have a question about something, we're there to help you out, and we're there to move forward. If in case there is things that are required, we let you know. We don't add anything that's unnecessary. We say, this is the mandatory stuff that you require, and we go from there.
Got you. I'm going to actually include all your contact information on our email as well when we send this video out, so people can be in touch with you. Good stuff.
Absolutely.
Okay. Well, thank you so much for your time, Aldo. Look forward to talking to you in the future, man.
Thank you. Thank you for having me. I appreciate it. Good luck with yourself, and stay safe.
You too. Thanks, Aldo.
Okay. Bye.